honourable member for Lac-La-Biche St. Paul, Two Hills.
Thank you, Mr. Speaker. Yesterday, the Health Quality Council reported that this government's decision on EMS were sloppy and mismanaged. Today, the government is poised to be making an even bigger mistake by moving medevac to the Edmonton International Airport. In 10 days, this fundamental change will affect all Northern Albertans, adding at least 40 to 50 minutes in emergency wait times. Stars Air Ambulance says it's too early to know if they can fulfill the new role envisioned by AHS. Will the Premier do the right thing, delay the relocation of medevac, and consult with doctors to ensure that any changes to medevac services will not cost lives?
Mr. Speaker, this fear-mongering is not constructive. Doctors have been involved. Technical advisors who actually understand emergency services have been involved, Mr. Speaker. Clearly, a decision has been made by the people of Edmonton and the City of Edmonton that we are no longer able to use the municipal airport. Because of that, Mr. Speaker, we have made the responsible decisions, the right decisions, and the decisions, Mr. Speaker, that will continue to protect families in Northern Alberta. Medevac will work, Mr. Speaker.
Thank you, Mr. Speaker. Given that a total of 58 doctors have signed a letter saying the relocation of medevac will cost lives,
58.
Will this do you think it is okay for this government to shortchange Northern Albertans, put their lives at risk, when you can just delay the decision to explore every possibility in order to save lives?
Here, here. 58 doctors.
Please be reminded that questions that are speculative ought not be asked in that way. We understand the intent of it, and if somebody wishes to answer it, we don't normally call for opinions, but if somebody from the front bench wants to answer it, go ahead. Minister of Health.
Well, Mr. Speaker, this government can do a lot better than speculative questions that are being proffered by the other side. Mr. Speaker, the opinions of people that live in the communities across the province are going to be informed directly by the quality and the accuracy of information that is presented to them by all of us as members of the Legislative Assembly. Mr. Speaker, planning for this move began well over a year ago when Edmonton City Council asked or announced its decision to close the City Centre Airport. Mr. Speaker, I can assure this House as the Minister of Health that there is absolutely no compromise to patient safety or quality of care as a result of this transition, and anything short of that in a message to the public is fear-mongering.
58 doctors say differently. Given that this Premier has previously said, and I quote, "We need to ensure that we are providing as a provincial government the services that Northern Alberta needs." How can Albertans trust this Premier if she won't even keep just this one promise and provide Northern Albertans with timely access to emergency medical care? Listen to the doctors and delay the closure. Listen to the doctors.
Mr. Speaker, let's remember that north of Edmonton there are thriving communities with hospitals and doctors and health infrastructure currently, Mr. Speaker. It is not as if everyone who lives in Northern Alberta, the minute something happens, is shipped on a plane to Edmonton in order to have their health care needs met, Mr. Speaker. We as a progressive Conservative government have made a commitment to health care in Northern Alberta, Mr. Speaker. We are continuing to make that investment in things such as the new Grand Prairie Regional Hospital, enhancements in Fort McMurray, Mr. Speaker. We know from experience and from strong health care professionals across Northern Alberta are providing effective health care services. Medevac is part of that, Mr. Speaker. It will continue to be, and Albertans can trust that.